Hey, everybody, it's time for another episode of the Michael Shermer Show, brought to you by, as usual, the Skeptic Society, a 501c3 nonprofit science education organization. If you want to give us a little support, you can go to skeptic.com/donate. We also publish Skeptic Magazine. Here's the new issue on culture wars. You may have heard that there are a few of those. We're still in print 30 years later. Look at that, 4-color throughout. Available in every fine bookstore in North America, or you can just go to skeptic.com/magazine and order it right there. We'll ship it to you from our offices here in Santa Barbara, or you can subscribe. All right, enough for the commercials. My guest today is none other than Jay Bhattacharya. He's a professor of health policy at Stanford University and a research associate at the National Bureau of Economics Research. He directs Stanford's Center for Demography and Economics of Health and Aging. Dr. Bhattacharya's research focuses on the health and well-being of vulnerable populations with a particular emphasis on the role of government programs, biomedical innovation, and economics. His recent research focuses on the epidemiology of COVID-19, as well as an evaluation of policy responses to the epidemic. Now, that's probably where you're thinking, what is this guy doing on this show? Oh, here it is. He became famous or infamous in some circles for his co-authorship with Suntra Gupta of the University of Oxford and Martin Kulldorff of Harvard University of the Great Barrington Declaration, which advocated lifting COVID-19 restrictions, this is back in 2020, on lower risk groups to develop herd immunity through widespread infection, quote, here I'm quoting from Wikipedia, while promoting the fringe notion that vulnerable people could be simultaneously protected from the virus. In a private email to Anthony Fauci, obviously no longer private, NIH Director Francis Collins called the authors of the declaration, quote, fringe epidemiologists, and said that, quote, it seems to be getting a lot of attention and even a co-signature from Nobel Prize winner Mike Levitt of Stanford. There needs to be a quick and devastating published takedown of its premises. Close quote. That is when Dr. Bhattacharya became known as a fringe epidemiologist. In fact, we met in Florence, Italy last week at a conference in which everybody was asking if he actually has a business card that says fringe epidemiologist. Do you, Jay?
I do, actually. A friend of mine made me. I think it made me my official business card now, Michael. So it's.
I mean, it's astonishing. You've become, hugely famous around the world, or infamous. What was that like? You were just kind of a normal college professor doing your thing, and then all of a sudden, boom, here you are.
I mean, I never saw it. Before the pandemic, I'd never written an op-ed. I'd never been on TV. I mean, actually, that's not true. I was on TV once in 2008. And I think my mom watched it. So it was, I love being a professor. I love teaching. I love research, the kind of back and forth with other people in scientific fields. I always found that fun. And to find myself in the spotlight in this way was just something I'd never prepared for and never really sought. And it's been a learning experience, let's just say.
Yeah. Well, I should point out, among your fringe credentials, you have published 135 articles in top peer-reviewed scientific journals in medicine, economics, health policy, epidemiology, statistics, law, and public health, among other fields. You have an MD and a PhD in economics, both earned at Stanford University. Some fringe. Okay.
So, all right. The nice thing, Michael, about having that title now is that if once somebody like Francis Collins gives you a gift, like calling you a fringe epidemiologist, you have to embrace it.
Yeah, that was a bit weird. I don't know Anthony Fauci. I do know Francis Collins back when he was doing his religious thing, and we exchanged some emails, and then I interviewed him for my book, The Believing Brain, about how far he wanted to take his creationism, because he's one of the staunch defenders of evolutionary theory, all the way up to the soul or something like that, right? So I said, why don't you just take it a little further? Anyway, but I always found him just a congenial, friendly, nice, respectable guy. I was so astonished to see his response to you and others.
Well, I think part of it is it's not so much Francis Collins, but like Tony Fauci is sort of the epitome of this. If you have somebody who's been in that kind of had that kind of power at the top of the scientific establishment for so long, to the point where he thinks that any criticism of him is a criticism of science itself. People, especially people with credentials, criticizing the policy responses that they're arguing for, they're not necessarily going to react constructively. Like a constructive reaction would be, well, let's bring Jay Martin Sinetter in, let's have a conversation with them, let's see where they're wrong, let's see where they're right, let's figure out what's going on. Is it really true that the scientific community doesn't agree with the lockdowns, or at least parts of it don't? That's what I would have done if I were in charge of the NIH at the time. But I think a lot of it is just hubris, Michael. Like once you are at the top of an organization like the NIH for such a long time, or the NIAID for such a long time, it's really hard to have people push back on you. You think that you're always right. It's really dangerous.
I wonder, yeah, okay, maybe. Could it be hubris, or could it be that's just sort of systemic into the job itself? Like you can no longer think like a scientist where you're kind of Bayesian in your reasoning. It could be this, could be that, let's wait and see. Now you're in a position where there is no wait and see. Tomorrow you have to face the microphones at the press conference, and they want to know, should we close the schools tomorrow or not? What do we do? I mean, you can't say, well, 60% this or that. They want an answer, right?
It's the medical model is actually the right model there, right? So like I did an MD. I don't practice, but I did an MD, and one of the joys of being a third or fourth year med student is you're sitting in front of a patient with a white coat and you don't know anything, and the temptation to pretend like you know something is overwhelming. And like what you learn very quickly is that if you pretend, you're going to get called out. You're just going to look like a fool, and people aren't going to trust you. Your peers aren't going to trust you. Your supervisors aren't going to trust you. The patients aren't going to trust you. You have to be honest. When you don't know, you say, I don't know. And I think that especially for someone in those top positions, is hard to do, but it's the difference between someone that is responsible to the facts and to the public and someone who is looking out for their reputation alone. Eventually you run out of answers, and you have to be on, and people will see that you've run out of answers. And I agree with you. You're right. You're absolutely right. It's not just simply hubris. It's also this like pressure to say something, especially in the middle of a pandemic and everyone's looking to you for the answers and you don't have them.
So what would be wrong with, and maybe nothing, with Fauci saying, I don't know, maybe January or February of 2020, we just don't really know about the masks at the moment. I think it'd be best if you didn't wear them because we need them for medical practitioners and healthcare frontline workers. So just lay off that for now. We'll get back to you in a week or two.
I think nothing would have been wrong with that. That would have been the right way to manage it. Like I think, there's an art to this. Like there's an art to, there's of course there's like one way we talk as among fellow scientists, right? We'll argue with each other all the time about 5 million things. Is really, I mean, that's what makes science fun, right? And in public, you don't necessarily do that, but you're trying, and you do need to simplify the message that you're giving to the public at large. So there's an art to public health communication. But the way you just communicated, Michael, is exactly the right way to do it. You have to convey on the most essential points, what's not known. You absolutely have to do it. And you have to convey, sometimes I've actually seen Fauci do this well occasionally. It's not like he's always bad at it. It's just like on the most central issues, like the gain of function work, on the lockdowns, and he basically gets into this mode where if you contradict him, you're contradicting science itself, and it's just a tremendously destructive thing, both for public health and for science.
Yeah. I just this idea that the public is too dumb, or they can't nuance arguments, or they can't handle statistics and probabilities. That's not true. If you look at the business section or even the sports section of the newspaper, it's chock-a-block full of graphs and charts and data and probabilities. And, this guy's hitting 347. Everybody knows what that means in baseball. That's not true that they can't handle it. So why not apply those same models in sports and business to medicine?
Yeah, and I agree with that. I think that underestimating the intelligence of the public is a big mistake. And I think public health does this all the time. If you read some of the minutes of some of the meetings regarding, so for instance, vaccine recommendations, right? So one thing I've advocated throughout the pandemic is a scientific fact, which is that if you have had COVID and recovered, you have substantial immunity. Tremendous amount of evidence from all around the world indicates that was true. And we've known that since basically since 2020. But when the vaccines came out, there was a debate whether you should actually advise people who have already had COVID and recovered that they're going to get less benefit from the vaccine. Now that's just a fact, right? The absolute mortality risk from the disease decreases substantially for someone who's has already once recovered from the disease and subsequent infections. And so the marginal benefit of the vaccination is going to be lower. That's just it's scientific fact, right? But you'll see them talking about how public health officials talking about how in order to simplify the message, we should just ignore that scientific fact. What that's going to end up doing is it's like people can see, right? It's not like they're dumb. They can see that the vaccine it isn't all that beneficial for people who already recovered. It's like that's not like it because the scientific fact is such an obviously true thing documented by data. And so then when you act as if people can't understand such a basic fact and then coerce people, everyone to take it regardless, so you can't get an exemption, people are going to stop trusting you. That's in fact, unfortunately, exactly what's happened with public health, Michael. It's like I've never in my professional career seen public confidence in public health so low in my lifetime.
Yeah, it's a different kind of backfire effect in which if you go down that route, people will find the information somewhere else. And maybe really fringe sites, of which there are plenty. Yeah, it's not a problem of intelligence or education. I mean, in my career, I've dealt with like creationists and intelligent design theorists and climate skeptics and so on. And these are smart people. They make really good arguments. You can't just dismiss them like that. So if, say, evolutionary biologists are not willing to admit, here are the things we don't know at the moment about like the origins of life. Because if you don't say that, then they're going to go to one of these other sites. Same thing with what you experienced there. Okay, let's rewind the tape to say, I don't know, November, December 2019. Is that about when we think it started to spread in the United States and Europe?
So we don't know the exact date, but okay. If you could argue with me, this says November 2019, I'd say yes, and I'd say August 2019, I'd say yes. I don't know for certain the exact date that it started to spread around, but I do know that it was much earlier than the January 2020 date. That's the official start date. It's very clear that the disease was spreading in China, very likely before the December 2019 date that they made available. And it's not surprising that would be even if you believe it's a natural origin, when it made the leap into human populations, it's there's an epidemiological course to these kinds of diseases. It takes a while before you start to notice them, and so regardless of what your opinion is about whether it's natural or gain of function or like just a regular lab leak, the date almost certainly is late 2019, at some point, fall 2019.
Yeah. What's wrong with the lab leak hypothesis? Why did that become politicized and a crazy conspiracy theory? It's not a conspiracy theory. It's that, they just screwed up. Things happen, human error. There's lots of examples of lab leaks in history. Was it that concerns for our relations with China, or we don't want to stigmatize Asians, or I don't know, what was your sense of why that became politicized?
Well, so I think that was the nominal argument that argument allowing people to think that there was a Chinese lab leak would make people, racist against Asians. I mean, that was the early. I think that was kind of nonsense, like weird cultural practices resulting in a leap in a wet market. Seems like that story would cause people to be more racist than a lab leak from some sophisticated set of scientists. I think the real thing that happened is that for a decade before the pandemic, there had been a debate and discussion in the scientific community about whether it was safe to do this kind of research. And it's not just the gain of function work, but there's a whole pandemic prevention agenda that involves going to the bat caves of China or wherever, right? Finding pathogens, bringing them into labs, playing with them to see, are they likely to make the leap? Will they pose dangers to humans? And the civilian argument that was given for this research was that we can identify those pathogens that are likely to make the leap and then develop countermeasures early so that if they does make the leap into humans, we will be able to respond to it immediately. For a decade long, there was some major debates among scientists whether that was a safe agenda. From 2014 to 2017, there was a pause in gain of function work that was directly related to that agenda. And Tony Fauci and Francis Collins and others had taken the side that this research was necessary. It was needed to protect human populations from the next pandemic. And so when this pandemic started, they must have suspected that it was possibly a lab leak. And if what that meant was that they supported the research agenda that likely caused this pandemic, you're going to be reluctant to admit that. You're going to want to look for evidence that's contrary to that. You're going to want to use your power to try to suppress the idea. I think that and the explicit politicization of it was essentially a tool in service of that agenda of reputational protection.
Yeah. What did you make of his appearance in Congress last week or 2 weeks ago, I guess now?
I mean, what preceded Tony Fauci's appearance in Congress was his aide David Morin's appearing in Congress right before that, where Morin's there are all these emails from Morin's where he talks about evading transparency requirements in the government, these FOIA, Freedom of Information Act requirements regarding the lab leak discussion, and he's contacting this man at this organization called Eco Health Alliance, which is this organization that the NIH used to fund the NIH lab, the Wuhan lab in China. And of course, that's become a political embarrassment for the NIH. And Morin's, in a whole bunch of FOIA emails, talks about how to evade oversight about this. And in Morin's congressional appearance was just a disaster for the NIH. Right? He looked like he was hiding things because he was hiding things. Tony Fauci came on and he essentially threw Morin's under the bus. He's been writing with Morin's on co-authored paper after co-authored paper for decades. He's like a close aide. Morin's is a close aide to Tony Fauci. And Fauci in Congress says, I don't really know him. I don't know who he is. I barely, we had to find some title for him. I don't talk to him. I don't know what he's talking about. He threw him under the bus. I mean, entirely, put the entire, essentially the blame of this cover-up operation on him. It's not plausible, David.
Oh my God, that's funny.
That David Morin's was the main guy that did this.
Can you explain gain of function? What exactly are they trying to do there?
Yeah, so there's a civilian public justification, which I think is meant in good faith and sincere. There's also a private sort of biodefense kind of justification, which we can talk about. The civilian justification is that suppose I go out into the wild places and I find a virus that only infects bats. The question is, how close in evolutionary space is it to make the kind of changes, the evolutionary changes, such that it can then infect humans and move from human to humans very easily? If there's only a few mutations needed to make that leap, then this is even though it doesn't yet infect humans, this is something we should be concerned about. If it takes a lot of mutations, if it's a lot of manipulation to make that leap, then this is a virus or a pathogen we don't need to worry very much about. So the civilian argument for gain of function work is that it allows us to ask the question, which of these viruses that are zoonotic purely are likely to have some in the evolutionary space close to being able to infect humans and make the leap from human to humans. And you have to, you play with the virus. I mean, in fact, it's like these evolutionary processes directly used to do gain of function work. One version of gain of function work, you run the viruses through, humanized mice or something, trying to select in the lab for viruses that infect humanized mice, so that you're sort of it's like a targeted evolutionary process to identify the viruses that are likely to make the leap. And then you look and see, well, what's the evolutionary difference between the zoonotic version of the virus and the version of the virus that can infect humanized mice? I mean, that's the argument. And then at that point, once you know that this virus might make the leap, you develop vaccines and countermeasures to the virus before it makes the leap.
Well, that sounds like a good thing.
That's the civilian argument.
Yeah. So in sequencing the genome of SARS-CoV-2, does it look like that's what it was, a product of gain of function, or does it look like Zoonomic?
So there's a tremendous argument among the molecular biologists. I am not a molecular biologist, so I should just say that up front. But I've been trying
not even a fringe microbiologist.
I'm only a fringe epidemiologist, Michael, not a molecular biologist. But I have been trying to follow their arguments very carefully. So there's a few arguments that I think are quite telling. One is there's so the way that the virus infects human cells is via something called a spike protein, which most people I'm sure have now heard of. Um, there's a particular molecular mechanism by which the virus enters human cells that's facilitated by something called a furin cleavage site. And basically what happens is the virus attaches to the outside of your cell. The furin, if the virus has this has a furin cleavage site, there's enzymes inside your cell that cleaves the furin at the furin cleavage site, facilitating entry of the virus into the genetic material of the virus into the cell, and then it takes over the genetic machinery of the cell and reproduces itself and does all kinds of nonsense. So the presence of the furin cleavage site is a unique thing among bat coronaviruses, from what I understand. All the other bat coronaviruses that are in this sort of family, none of them have this furin cleavage site. Only this one does. There are other viruses that have this kind of furin cleavage site mechanism, and there was a proposal written by people at the EcoHealth Alliance in 2018 called the Diffuse Proposal that talk about how to manipulate bat coronaviruses to make them more infectious. Some of the molecular biological features of this virus show up in the discussion in the 2018 Diffuse Proposal. Another example of something that sort of like a molecular biological tell that of this virus being manipulated is okay. So this is a little technical, but like if you have a virus or if you have genetic material, very often there are these things called endonucleases. You can think of it as molecular scissors to cut the viruses into parts or the genetic material into parts so that the parts are easier to analyze and deal with. And it's very common technique in molecular biology to use these molecular scissors. There's lots of different kinds of them. There's a group of scientists that asked, well, if you use the molecular scissors that are commonly used in this kind of setting, how evenly are the pieces cut up when you apply them to SARS-CoV-2, the virus that causes COVID, versus if you apply them to other bat coronaviruses? And it turns out that they're very evenly spaced for a particular endonuclease that they used. Whereas if you apply them to all the other bat coronaviruses, they all the spaces that it applies to, it cuts them. The way these endonucleases work, it looks for a particular tiny sequence and cuts there, right? And it cuts it up into random size segments for the other bat coronaviruses, but evenly sized segments for this coronavirus. And now there's lots and lots of endonucleases you could use. It turns out that the ones that were proposed to be used in the Diffuse Proposal on this kind of agenda for bat coronaviruses is exactly the one that the scientists, Alex Washburn being one of them, predicted would be used if you were trying to manipulate a virus like this. So there are other molecular biological kind of pieces of evidence. I think those are I've seen molecular biologists argue endlessly about whether it's enough, right? I think that alone doesn't get you to it's guaranteed to be engineered. Like I can see people arguing the other way, but I think it moves you far in that direction.
Yeah.
What convinces me is these people look like they've covered it up, Michael. They look like these people, meaning like Tony Fauci, Jeremy Ferrar of the Wellcome Trust, many of the molecular biologists and especially the molecular biologists associated with the EcoHealth Alliance, they look like they've worked to cover up the possibility of their collaboration with the Wuhan lab, the kind of research they were doing, and the Chinese government especially has worked to cover it up. They have not released the full set of sequences that they were working on in bat coronaviruses. They've taken offline sequences that they had online before, so that we could, it's harder to tell where in evolutionary space this virus belongs. It's the kind of thing people do that even if they didn't do it, they think they might have.
Mm. And why would they cover it up? Just to erase their responsibility in the deaths of millions of people, something like that?
Yeah, I mean, think about this. Like, you kind of need Shakespeare to write this up. Not to personify like Tony Fauci as the main villain, but like imagine you're Tony Fauci and you've spent your career aiming at getting an HIV vaccine or trying to save human life, and all of a sudden your legacy is going to be you supported research that caused the death of tens of millions of people, catastrophic economic damage, harm to children.
Yeah, but again, why not just say, look, this is what we do. This is the civilian program that you just outlined. We've been doing this for years. It's important we do this to prevent future pandemics and so on. This one just went awry. Sorry.
I mean, it's one of these things where, like, the man is at the end of his career. It's sad, right? Like he's an eminent scientist. He's going to be remembered as somebody who caused a tremendous amount of death. It's a black mark on science. It's a black mark on him. It's very, very difficult, I think, to say, look, I did wrong. I mean, Michael, you know this. We all know this from firsthand experience. Like if you do something a little wrong, it's okay. It's hard to say, no, I did it. If you do something catastrophically wrong, I mean, I can psychologically understand it. As a professional, it makes no sense. Like, of course, you should take responsibility for the part that you played in it. And I don't think that it's not like Tony Fauci was in the lab himself concocting the virus. But he did support the research agenda that may have led to this. And there was a fight earlier about whether it was wise to support such a research agenda. And I think that is the fundamental problem, is like you have his entire reputation, future reputation at stake. Will he be remembered as somebody who was a major player in leading to the better treatments for HIV and focusing research efforts there, or will he be remembered as the man who supported the research agenda that led to the deaths of millions of people?
If I pulled in Anthony Fauci right now, what do you think he would say to all this?
Well, I think first he'd say that he didn't fund gain of function work, right? You saw him talking Rand Paul. I think that's an invasion. I mean, like, he's funding work that involves bringing dangerous pathogens and trying to see if they're going to infect humans. Like, it's possible. If you want to call it technically gain of function or not, I don't care. But that's, I think, what it would be an argument. He'd say that he didn't personally make the decision. In fact, there was a body called the P3CO inside the federal government that makes decisions whether to conduct this kind of, to support this kind of research. But again, that's an invasion because he's the one that set up the P3CO process, and he's the head of the NIAID. He effectively signs off on the processes that lead to the research being done. And he was a major advocate for, during the 2014 to 2017 period when the gain of function work was paused, to lift the pause. He put the P3CO kind of framework in place in order to not have his fingerprints on a process that would lead to support for gain of function work. So I think he'd say those two things about his responsibility. The other thing I think he'd say, and he said this in Congress, is that, look, I didn't actually direct the sort of effort to cover up the gain of function. And as best I can tell from publicly available evidence, you could squint at it and say maybe so. I mean, it looks like he's involved in the cover up, but he's not. Doesn't say like he's leading the cover up, and So I don't. That's plausible. I think. I don't know if I believe it, but it's you could make an argument. So I think he'd say, look, so I wasn't leading the cover up. Even, for instance, the email from attacking me as a fringe epidemiologist and calling for a devastating takedown, that didn't come from the pen of Tony Fauci. That came from the pen of Francis Collins, right? So he can say, well, look, I wasn't involved in any devastating takedowns. And so all of that looks superficially like it might be reasonable, except it's not, right? He's in the press telling the press that I want to let the virus rip.
Yeah,
when
right.
What I was calling for was focused protection of vulnerable older people, right? He calls it nonsense. No scientists would agree with it, and then yet in their emails they recognize their Nobel Prize winning scientists agreed with the Great Barrington Declaration, right? So you have this he's very, very clever. He's incredibly good at covering at making it so that he's like whatever decision he makes, he can plausibly deny that he made the decision. But he has, at the end of the day, tremendous power as head of the NIAID. He has a cadre of scientists who were like beholden to him because he's made their careers. $8 billion a year of scientific funding will do that. And so I think it's unfortunate. I think if he had used his evident gifts for just for the scientific work, if he'd been honest that, okay, this was a mistake, I think history would look back on him with a lot more sympathy, because I don't think that he was trying to do evil here.
Why does why does the origins question matter? Is it politics, or is it we want to prevent this from happening again?
I think well, I mean, politics. It's really odd to me that it is political, Michael. Like this is one of these things where like I cannot. If you'd asked me in 2019 or 2015 to like predict which political party would be for or against gain of function work, I would. I mean, who the hell would know, right? It's not a political question. It's a public health question, right? It's a question of how best do we protect the public from pathogenic threats, zoonotic pathogenic threats, and the trade-off is, if we don't know about the zoonotic pathogenic threats, they might make a jump when we don't even know or not ready, versus we, in the process of looking, we cause a zoonotic threat to become a human threat. Though that's the trade-off. That's the debate. And so the reason why gain of function, this debate matters, is because of that debate. Like, should we be doing this research at all? Does it make it more likely that pandemics will happen? And if this one was caused by gain of function work or by this whole agenda of finding viruses in the wild and playing with them, then we should be doing. It's like it's like nuclear testing of weapons, right? We have a nuclear test ban treaty that took decades to get into place, but it was a really wise thing to do, I think. I think that it's that kind of level of threat to humanity that we're talking about here, and that's why I think the debate matters.
Yeah, and at the moment you'd put it, I think you told me 80-20. Lab leak versus zoonotic.
I'm more on the lab leak side, I have to say. I mean, it's hard to be certain with all the. I mean, we don't have the full data sets yet, but I'm pretty. Like I said, I think I'm persuaded by the molecular biological evidence to maybe 70, 60, 40, something like that. But the cover up pushes me much further along.
Interesting. Yeah. Well, there are very few things in science in which you'd say it's 99-1, maybe Big Bang theory or theory of evolution or something like that. But most are operating under great levels of uncertainty, and there's still a lot of anomalies in almost everything. What do you do with the anomalies? A lot of people build whole new theories over them. You don't have to do anything. You just say, we can't know everything, right? And then just move on from there. Okay, so you published the Great Barrington Declaration. By the way, that comes from a place called Great Barrington, or just Barrington? Or
So I wrote it with two very eminent epidemiologists, Martin Kulldorff of Harvard University, he actually developed the statistical system the FDA uses to track vaccine safety. And then Sunetra Gupta, who is she's like, what is she, like the way they talk at Oxford, it's like professor of theoretical epidemiology, like she's the only one. I mean, it's kind of like that kind of level of, she's an amazing scientist. She's working on the universal flu vaccine. And so they write this, Martin arranges this meeting in Great Barrington, Massachusetts, which I'd never heard of before, in October 2020. I fly across country. I feel like a rebel because, no one else is flying. But Martin told me Sunetra was going to be there, and we're going to meet with the press to talk about our views about how to manage the pandemic. No lockdowns, no school closures. Yes, protecting vulnerable older people better. Don't send COVID infected patients to nursing homes, for instance. So like we're at that meeting, Martin and Sunetra and I were just talking. We realized we'd essentially come to the same place from slightly different angles. And we wanted to tell the public this. We wanted to let the public know that it wasn't true that there was a consensus in favor of the lockdowns. That's why we wrote the Great Barrington Declaration. My main contribution, I mean, okay, maybe I saw it, but like the most important contribution was on the drive in to Great Barrington. I asked the guy who's driving me in, is like, what's the name of this town? I never heard of it. I heard the word Great, and then when it came to name the thing, I was thinking of the Port Huron statement. I'm like, how about Great Barrington? It's a great.
It's a great
people
title.
are going to be confused. Is it the declaration that's great, or is the town that's great? I mean, so it was a fantastically. Anyways, it's I probably shouldn't joke too much about it, but it was
Yeah.
It was funny because the town itself didn't like the declaration. There were lots of people wrote in the town newspaper arguing, saying it was like we'd shame the town by naming it that. But I do think that they're going to look back with pride on it as the way I do. I think we were right about that. I don't think we should have closed the schools. I don't think we should have disrupted the lives of so many people in a futile bid to stop the disease from spreading.
Okay, but now hang on. So this is late March 2020.
No, this is
So,
October 2020. October 2020.
okay,
Yeah.
what was in the? Oh, you wrote the op-ed piece in the Wall Street Journal in.
Yeah, that was an op-ed I wrote in March of 2020. There, I argued along the lines of what you were saying earlier that we didn't know how deadly the disease actually was because we were missing a key fact. How widely had it already spread through the community as of March or April 2020? And I argued that we couldn't really make good policy without knowing that basic fact, like
So
how
by
transmissible
October,
it is.
then the 2020, you were confident enough to make a decision like that.
Yeah.
So
So it
yeah,
it took. I mean, there were a lot of evidence that come in from lots of different countries had done different things. Sweden had done a bunch of very different policy than the United States had. California had done different things than Florida had. And the data were already coming in pretty clearly about the damage of the lockdowns, especially in the poorest countries of the world. Hundreds of millions of people were thrown into threat of poverty. 100 million to dire poverty. It was clear the lockdowns had not worked in the developing countries. There was a seroprevalence study in July of 2020 in Mumbai, India, that found that in the slums of Mumbai, 70% seroprevalence, despite a severe lockdown imposed by Prime Minister Modi. So it was clear the lockdowns were doing a lot of damage without doing a lot of good. And that was what motivated us to write the declaration.
yeah. So certainly by then we knew that the most vulnerable population were elderly people and people with pre-existing conditions, and not children, for example. And that was clear by then.
That was, I have to say, it was clear by January 2020. If you looked at the Chinese data that were being published in places like JAMA, almost all the deaths were older. Like 80% of the deaths were people over 65. The data coming out of Italy said the same thing. Literally everywhere you looked, it was hard to find a child death, and very, very easy to find lots of older people dying. It looks from the research I've done. The mortality risk in 2020, and actually still today, I think, from being infected with COVID increases exponentially with age. Every 7 years of age doubles the risk.
Mm. And then you factor in pre-existing conditions, obesity, diabetes, heart and lung disease, and that ups it.
Yeah, so it's interesting that's also a doubling. So if you go from obese to non-obese to obese, that's like aging 7 years. If you go from non-diabetic to diabetic, that's like aging 7 years. Those things do matter, but age is the most important risk factor. Certainly, the most important risk factor that you can use from a policy perspective to address.
Now, why is that? So the virus is attacking your body, and is it just overall lack of resiliency to assaults on the body? And the younger and healthier you are, you can just withstand it longer and better?
I think there's an evolutionary reason, actually, Michael. I think that if you think about babies and children, they've never been exposed. Their immune systems have been exposed to very little. I mean, they get some passive immunity from their moms in utero, but mostly everything they meet is new. And so our immune systems are, when we're young, are almost like they're tailor-made to deal with new threats. And over time, what happens is we get more and more specialized in the kinds of threats we can deal with. Our immune systems do. And so by the time we're old, we're great at dealing with the threats we've seen before, but not so great at dealing with new ones.
Yeah. And what was the rationale, because I never got it living here in Santa Barbara, to close the beaches and the hiking trails? And I mean, wasn't there evidence that being out in the sun and fresh air is good?
There was a paddleboarder in LA, in Santa Monica, where I once lived. They went and arrested him in like March of 2020. He's like paddling boarding alone in the middle of the Santa Monica beach, and they have like some Coast Guard boat coming near him. It was insane. It was very clear early on that the virus spreads via aerosols and indoors. Right. So you had that Chinese restaurant study, the very famous early on, where one guy at one side of the Chinese restaurant in China, I think it was in China, is sick. There's a fan or air conditioning blowing on one side, and the guy at the other side of the restaurant gets it. Right. That tells you a lot of things. It tells you almost immediately that it's it's spread by aerosols. That means that masks are going to be very difficult to use to suppress the spread of the disease. Because masks aren't very good at suppressing viral aerosol spread. It tells you that indoors is really where the risks are, that like ventilation probably is the right target for intervention. It tells you, and then as time goes on, there are very few cases identified where people spread it outdoors. and time, when I say time goes on, like within a month, right? You're just finding no cases spread outdoors. And we know that metabolic health is important for how you deal with when you do get sick. If, as you said earlier, obesity, diabetes, and so on, all of those things make it worse when you get COVID. So why are we telling people not to go outside and have and exercise and do the things that would make them metabolically more healthy? It made no sense.
But who thought it did make sense?
Well, you had these these models, very, very unrealistic models of human behavior at the center of projecting how many cases there would be. Like the most famous one is the Imperial College model of March 2020, predicting that 2 million people would die within 2 months or something if you didn't lock down. The nature of these models, it's a very, very stylized view of human behavior. They randomly humans randomly meet with each other, and if they randomly meet with each other, they are more likely to spread the disease to each other. If you keep them apart, they won't. That's the whole structure of their model is like that. There's a little more complication than that, but that's roughly the structure of it. It doesn't because they didn't know at the time. It's forgivable in one sense. They didn't know. They didn't build in where the kinds of places people would meet, make it more or less likely. They didn't build in ventilation. They didn't even know the infection fatality rate correctly. They put in a very high infection fatality rate, and so there are all these uncertainties that went into the model, and then the output was 2 million people are going to die if you don't lock down. That was actually, I think, a responsible use of modeling and irresponsible communication about the uncertainties related to that modeling, because that led to tremendous numbers of politicians saying, "Oh, we better lock down, or we're going to be blamed for killing millions of people."
Yeah. There's a pizza place across the street here. I went in the middle of all this, and I forgot my mask. I left it in the car. Like, sir, you got to go get your mask. I'm in line to make my pizza, and the guy sitting right next to me has no mask because he's eating. And so I said, "Sir, how does the virus know to come along and skip this guy, go over his head and into my mouth?" He's like, "Sir, I'm sorry. I just have to enforce the rules."
Michael, I mean, the thing is, like, if you want to undermine public confidence in science, you say nonsense like that. Say, "Oh yeah, you can go to the restaurant, you can eat and sit down without a mask, but you have to wear it when you walk." And people go, "Wait, what, these are scientists telling me this? Like, what the hell?"
Yeah.
There was a lot of the recommendations, I think, were the result essentially of panic on the part of the public health class. People looking at them for recommendations what to do, they don't know what to say, and they're like, "Okay, well, we'll just try anything." The Swiss cheese model is a good sort of the epitome of this. The Swiss cheese model was, well, every single slice in the virus protection kind of panoply may have holes, but if you put all the slices of cheese together, the mask, the social distancing, the closing schools, and all of that, eventually we're going to protect everyone, right? Because some, the holes will be met with like covered up cheese somewhere, right? But the funny thing is that is a example in engineering of engineering failure. What if the holes line up and then the virus goes through the holes? I mean, and in fact, that's exactly what happened. Like, human societies are not built for lockdowns. I call them trickle-down epidemiology. Like, it's essentially like only a certain class of people, Howard Hughes can stay isolated from humans for a long period of time in order to avoid pathogens. The central dogma was that we are all merely biohazards. Humans are merely biohazards. So, like, I don't know if this ever happened to you, Michael, but like I'd walk down the street and I didn't have a mask, and someone's walking down the other way, and they jump off the street in order to get away from me. I mean, just
yeah. I do these group rides with a Peloton. So maybe you have a couple dozen cyclists in a row, 2 by 2 by 2. And there was some that's like, I can't come out because, the guy in front, he may sneeze and then the aerosol will come back and infect everybody. We're outdoors. It's windy. It's sunny. It's what? But people just got scared about that. Okay, did anyone in doing these calculations, it's kind of a signal detection problem. How bad will the virus be? How bad will it cost us if we shut down the economy? Since you work in economics also, did anyone do the calculations of if we close down all small retail businesses, what will that cost those owners, their employees, the U.S. economy as a whole, or the European economy or whatever, and that'll cost this much versus the cost of the virus spreading?
I mean, domestically, there was such a calculation done. In fact, that led to the CARES Act, which gave these like massive loans to like small business owners and others, to sort of protect them against that kind of shock. And then the Inflation Reduction Act, I guess, in when the Biden administration came in, another $2 trillion. So it's like something on the order of $6 trillion was spent. And there were economists saying, look, this is going to cause inflation, which it absolutely did. It's going to cause, I mean, we had unemployment rates in California that were like, tremendously high. Every state that locked down, the sharper the lockdown, you had this unemployment. The damage to developed country economies was tremendous. I mean, we're still paying the cost, but we're going to be paying that cost about the rest of our lives. But the damage to the poorest countries was even worse and just unforgivable, right? So the last 40 years, the world has globalized. You had all these countries joining the World Trade Organization with essentially reorganizing their economies to better fit in with the West. What that means is you change the nature of work that's done in the poor countries, so that that there's more trade, that can be trade relations and happen. And in some ways that was a great success, a huge reduction in dire poverty around the world as a consequence of this sort of globalization, I think. But it comes with an implicit promise that we're not going to lift up the drawbridge whenever we want. That's what the lockdowns were to the global South. The global supply chains essentially being disrupted. The pointy end of those global supply chains was some poor guy who had a job that loses a job in Mumbai, in Uganda, in South Africa, wherever, and now they're in dire poverty. The World Bank estimated an increase in dire poverty of 100 million people thrown into poverty. $2 a day less of income. The UN World Food Program estimated that in April of 2020 that 130 million people would have food. They call it food insecurity, but really what it is starvation. We'd starve 130 million additional people. When I saw that, I thought, okay, this is such an irresponsible policy. We've made such a big deal of globalization. Surely the West can't possibly continue to support lockdowns. And yet we did. It was I wrote a piece excoriating economists because I mean, to me, like it was such a disappointment to see so many fellow economists get behind this, knowing full well, I think, what the economic harm was going to be, and it wasn't just money, right? It's the lives of these people. We're talking about like starvation in the poorest countries. Money is health. Actually, that's true in the United States too, but like it's certainly in the poorest countries. It was such an irresponsible policy. It's a luxury of the laptop class to lock down.
Oh, totally. Yes. Because it didn't affect me at all. I was just teaching my classes by Zoom and still getting my paycheck, publishing my magazine, writing my next book. I do all this by myself anyway. So, but you just look around, the woman that cut my hair, I had her come up to my house and just paid her because I felt bad. It's like, well, I can't go to, okay. I mean, it's just crazy. Okay. Masks, why would they not work up for an aerosol virus? It seems like, a mask, even just a cloth around my face, is better than nothing. Maybe it cuts out 50% or something. What's wrong with that argument?
Well, so first of all, the way that people generally wear masks, there's gaps, right? So if you ever you don't have glasses, Michael, but if you have glasses, your glasses fog up. That's aerosols escaping up the top of the mask, right?
Right.
So and it doesn't. The thing about viruses, because they replicate so easily, you don't need, like, the dose response is not that I need to get a massive dose in order to get infected. Some viruses, even small doses, lead to replication that then lead to get you really infected, right? It's just a matter of how long it takes to replicate inside of you, not necessarily the dose response. I mean, and so like people got fixated on this dose response argument when in fact this virus seems to replicate very quickly, even with relatively small doses. I mean, I'm sure there's some dose response issue, but the protection was far from complete, and you just needed some small exposure. The way that the masks work, there are gaps in the weave of the mask that are much larger than the particle size of viruses generally. Now, these viruses, they are inside small water molecules, right? The water aerosols. Or droplets is just like it's a bigger aerosol, right? but even the aerosol size is smaller than the gaps in the mask. Now, the N95 masks are interesting because although they have the gaps, the way they work is by an electrostatic charge that attracts the particles. And so they're actually pretty good, even for viruses, until they get wet. And the electrostatic charge sort of like dissipates, I think, if I understand the physics of it correctly. And so that's why in hospitals, you're told to change the mask every couple of hours. You need mask breaks because you need to have no gaps. And you have to fit really carefully. The men should shave before they wear the mask if they want no gaps. It's really hard to get the population at large to adopt them in the right way. And so it's not surprising that when randomized trials in populations have looked at this, they find it very hard to find any protective effect of the masking at population scale. I'm not saying that certain masks can't protect against certain risks. Certainly for against tuberculosis, you know, in you're working in a hospital, it's a bacteria, the mask will protect you very likely if you wear it right. But to tell the population at large, just wear a mask, it's not going to hurt you and it'll protect you, that was very irresponsible. A lot of vulnerable people went out into public at the height of the pandemic wearing a mask thinking they were protected when they weren't.
I see people driving around here by themselves in the car with the windows rolled up wearing a mask. What are you going to get it from the radio?
I don't know. I mean, we make fun of regular people. Michael, at Stanford, where I teach, there was some wit did this study where he counted how many student bicyclists were walking or were riding around with no helmet, but were wearing a mask.
Right. Perfect. That's great. Yes. Okay. Get your thoughts on hydroxychloroquine, ivermectin, remdesivir, vitamin D, and then some of the other treatments, Paxlovid, Tamiflu.
So you want me to do all the hot button topics?
Just start with the the stuff that came out early, hydroxychloroquine, ivermectin.
I think just as a general matter, I think that when you have a new disease and you don't know what to do, you should be more loose with like the criteria for deciding whether to say yes or no to a drug, right? I that's my general take on things. And you should have a bias toward drugs that are safe, that you know to be safe, right? So hydroxychloroquine, the reason there were some very, very early observational studies suggested it might be useful. And so I thought it was reasonable to look at it. I don't think in the randomized trials that have been done since, they showed they didn't work. I do think it was a reasonable hypothesis, and I think it was unfortunate that it got politicized. I think President Trump talked about it in some press conference, and all of a sudden everyone's like certain that it doesn't work. Well, I don't know. I mean, you still got to do the. I mean, it doesn't, like in science, it doesn't matter who says what the hypothesis is. You just have to if there's a reasonable hypothesis, you have to check it. And I think hydroxychloroquine ultimately didn't prove to work in the randomized trials. Ivermectin is a little more complicated. The early randomized trials suggested it worked. A lot of them, actually, from all around the world. Later randomized trials failed to find an effect. And the question is why? How do you reconcile those? One way to reconcile those is to say, well, look, those other early randomized trials were poor quality randomized trials. They weren't doing it right. Later ones were more rigorous. I'm not sure that's the case. I mean, like, I don't think the lack of rigor is really it explains really the difference. I think my hypothesis on ivermectin is that the mechanism is that it reduces the amount of like your immune overreaction. Like, it's a great antiparasitic because it's immune overreaction that's one of the major problems in parasitic infections. And so that's a problem with COVID too, was immune overreaction. That's why like dexamethasone works in hospital patients. Like it reduces the amount of immune overreaction. It's a steroid, right? That reduces the amount of immune overreaction in hospitalized patients. And my hypothesis was that, well, maybe ivermectin works the same way. If you have a population that's immune naive, you're much more likely to get a lot of patients with immune overreaction. If you have a population that's not immune naive, that's had COVID, recovered, or had the vaccine or something, the marginal benefit for a drug like that is going to be lower because you're less likely to get it anyways. And so earlier, you have lots and lots of immune naive patients walking around, and you run randomized trials and you see it works. Later, you're going to have much larger randomized trials to find sufficiently powered estimates of it working. So I think that's my story I tell about the literature. It's one of these things, again, I'm not 100-0. I'm more like 70-30. I'm willing to be proven wrong on this. I don't like hold this particularly strongly. I do think it was irresponsible to criminalize ivermectin, right? The FDA saying, it's only horse medicine. Well, that was a lie. It's not only horse medicine. It's one of the most important human drugs, actually, for parasites. It's probably cured more blindness than any other drug because it's used for onchocercasis. It's a great drug. It should never have been demonized. And a lot of people went and took horse versions of it because they couldn't get it over through their prescription, and so they overdosed on it. It's a very, very safe drug if given the right dose. We should have just allowed doctors to prescribe it because it's a safe drug. I mean, and we could fight over whether it worked or not. But at a time when no drug worked, why not let doctors experiment with it?
Yeah. That's right. They accused Rogan of taking a horse tranquilizer or whatever that. Yeah, it's like what? Okay, and then the hydroxychloroquine. Wasn't there some guy who found that it's an ingredient in his fish tank stuff, and he drank that? And
I think it's like a derivative. It's not exactly hydroxychloroquine. Yeah, there was exactly, but that's exactly the danger. As soon as you criminalize it, it's a relatively safe drug. When I was a medical student and I worked in India, I took it as malaria prophylaxis, like every week. So it's not like it's an unsafe drug if given at the right dose and prescribed, with the supervision of a doctor. That's what should happen. The reason why you saw those crazy things happening is because people thought they couldn't get it through their doctor, which is true. Like doctors lost their licenses for prescribing it. So I just don't. It doesn't strike me as like malpractice in the way of like, I operate on the wrong eye or something. It strikes me as like doctors are trying to figure out what to do for patients in the context of a disease that's brand new, and allowing some of that experimentation is not a bad thing. I think it should have been allowed in a controlled way rather than demonized.
I tried it. One of my cycling buddies is a medical doctor. He goes, "You got to try this, Shermer. This is good." Because then at the time, it wasn't clear that it wouldn't work, and it might work. And this is long before I got COVID. So I did. And then one day I came back home from a workout, and my wife says, "You stink," because I don't normally just normal sweat. And I realized, this is coming out of my pores in the sweat. So it's not free, right? There are side effects of anything that you do.
Every drug. I mean, this is medicine, right? Every medicine is a trade-off. That's why economics is so useful in medicine. Turns out, like
that's right.
You think about it, every drug has some potential side effects and some, and hopefully lots of benefits. And the question is, for each patient, does the benefit outweigh the harm? That's the philosophy of medicine. Philosophy of medicine, you don't treat a number, you treat a patient. So you have to and you may have randomized trials, but you have to apply it to this particular person. So it's an art for a reason. I think I don't understand how that idea sort of got undermined during the pandemic, but it certainly did.
Yeah. Okay, let's apply that model to the vaccines. They're not risk-free either. If you give 1 billion people something, if it's just 0.0001% that have a side effect, that's enough for the evening news every day. If somebody had some weird. So apply that to that and just talk about like myocarditis. I remember that came up when Rogan had on Robert Malone on a show. And I thought, what is this thing with myocarditis? It turns out that is a side effect, right?
Yeah, it is a side effect, especially for young men. And that was known fairly early, actually. It's really clear from the early data that was a signal. And it shows up in any sort of reasonable study that looks at this, that you see this massive signal of myocarditis, inflammation of the heart muscle of young, and it's really especially concentrated in young men for reasons I don't fully understand. But the vaccine, like just stepping back about the use of this vaccine, right? So you have a disease that is very deadly to older people, much less deadly to young people. So the absolute benefit from the vaccine is automatically going to be lower for the young and higher for the old if it works. The vaccine trials did not have mortality prevention as an endpoint. They were because they had 40,000 people in it. So in the I think the Pfizer trial is something like 40,000 people, 20,000 with the vaccine, and that's a reasonable number, but not enough if you want to measure whether it protects you from dying, because the risk of dying from COVID is relatively small. It's like in the population at large, maybe 0.2, 0.3, 0.4% of in 2020. Whereas if you have a higher mortality disease, then you can get away with a smaller sample size. 20,000 arms are not large enough. So they had prevention of symptomatic infection as the endpoint for 2 months. That also doesn't tell you whether the vaccine stops you from getting and spreading COVID. You can have asymptomatic infections. You can spread the disease even without knowing it, right? And the trial could have been designed to check for that, but it wasn't. And so what do you do with that information? In December 2020, you have a trial like that tells you it protects against symptomatic infection for 2 months at 95%. You don't know if it protects against all mortality. You don't know if it protects against getting and spreading the disease. My view of that was, well, we know enough to recommend it for older people. I don't know what all the side effects are. When you roll it out to billions of people, you're going to find side effects, and you better pull the drug or give a warning or something very quickly as soon as you find it, right? But you know enough to recommend it to older people because they're the ones that are high risk of dying, and that's who likely are going to be protected against dying if you take the vaccine. For young people, it doesn't make sense. They have a very low benefit. Even at maximum benefit that they could get is low because the risk of dying from the disease is very low. And there could be side effects. Any side effects would then counsel against giving them that because the harms would outweigh the benefits for them. So I wrote an op-ed in December 2020, arguing this is how we should use the vaccine: focused protection of older people. Maybe that shouldn't surprise you given the Great Barrington Declaration. But then we argued that what happened with public health is they decided that the vaccine would stop you from getting and spreading COVID, and they would be you could use it for herd immunity, which was a tremendous mistake. The randomized trials did not allow them to say that, and as a result, they recommended that young people take it. They recommended it be mandated that everyone take it because their idea was that if everyone doesn't take it, the disease will continue to spread. Of course, even if everyone took it, the disease would nevertheless continue to spread because the vaccine doesn't stop you from getting and spreading COVID. The waning of the efficacy against symptomatic infection is pretty quick. Within 3 months, it drops to like 60%, and then within 5 months, it's like much lower. There were studies coming out of Qatar, out of Sweden, out of Denmark, a whole bunch of places, Israel, showing exactly this in 2021, and yet public health officials persisted in demanding that everyone take the vaccine. It's a tragedy, Michael. It is an absolute tragedy. I think if it were just simply used to protect older people, it would have been seen as an unmitigated success. There would have been some side effects, and we would have lamented those, and we would have tried to work against those. But it would have seen a success. Instead, what happened is that I've never seen anti-vax sentiment as high as it is currently. And it's because the public health officials that people trusted said things that were so clearly wrong, especially if you get the vaccine, you can't get it and spread it. They demonized people that didn't take it. People lost their jobs over this. They couldn't travel. You still have the case where like immigrants, legal immigrants can't come to the U.S. unless they're vaccinated. So they're like family reunification problems still happening to this day.
Wasn't the argument that young people will then spread it to grandma? So to protect grandma, you have to get vaccinated, even if you don't really need the vaccine.
Yeah, I mean, that's the argument. The problem is that scientific evidence didn't justify that. There was no evidence that said that taking the vaccine stopped you from getting and spreading COVID. You weren't protecting grandma. You could still spread the disease to grandma. And so that I think that, and of course, grandma is vaccinated, so she's as protected as she can be. Right. So you just at some level, or she's had, or the people that have already had COVID before, like healthcare workers are a great example of this. A lot of nurses quit because they were forced to take the vaccine they didn't want. They had already had COVID in 2020. They were protected against getting and spreading COVID better than the vaccinated were. And yet they lost their jobs. We had nursing shortages as a result of this insanity.
Yeah, no, it's crazy. All right, let's apply the comparative method of research to see different experiments that were tried. Like within the United States, which states, I think you worked with Florida, had better outcomes with moral policies more along the lines of what you wrote in the Great Barrington Declaration versus other states, and then compare, say, the United States to Sweden or something like that.
Well, California versus Florida is such a clean comparison, very similar, in terms of like the kinds of like climate and all that. I mean, Florida's a little bit more humid, but Florida followed a policy where they opened schools. They required in-person schooling in fall of 2020. The governor prohibited mask mandates, prohibited vax mandates. The government and the legislature and in worked very hard to like develop to like give resources to older people that were sick. Right. So, for instance, he had a policy where monoclonal antibodies, an approved treatment. Normally, you'd get it in the hospital via IV. He put in a policy where if you got sick in 2021 and you were older, you could call and a team would come to your house and deliver monoclonal antibodies to you at home. Right. So, like innovative policies trying to protect older people. He certainly didn't send COVID-infected patients into nursing homes, unlike in New York. So that policy with open schools versus California, where I live, my kids, you live. My kids didn't see the inside of a classroom for a year and a half. Right? It was a very restrictive environment for children. The all-cause excess deaths, age-adjusted, because Florida is older than California, all-cause excess deaths through the pandemic era were lower in Florida than California. California did worse at protecting human life than Florida did. I tell people this, they don't believe me, but that's what the data show. Sweden has among the lowest all-cause excess deaths in all of Europe. In fact, all of the world. If you think lockdowns were necessary to protect human life, Sweden is a counterexample that you just can't get around. They were not necessary to protect human life. There were other policies that were possible to protect human life, and Sweden has no learning loss in its children. The economic damage from the lockdowns was much less. The psychological harm from the lockdowns was much less. People trust the public health system there, which is an incredible thing. I'm kind of jealous, Michael. I don't know what it's like to be in a country that's like that.
Yeah, Michelle Gelfand did research on that of tight versus loose cultures. She's a cultural psychologist, and that cultures in which people are more likely to kind of follow the public health advisory, are very different than, say, Italy and the United States, which are more individualistic, and then they have different outcomes. That was like in the middle of the pandemic. She published that paper. Super interesting. I'm not sure what Sweden is. Probably more homogeneous and a tighter culture like that.
I mean, I think Sweden's such an interesting place. There's like a big fight over immigration there. I think they're kind of a society in flux. But they are a high trust society, and that showed in how they managed the pandemic and how the compliance they got from the population. Mainly the public health authorities. Like it's just we were talking at the beginning of our podcast. The public health authorities were very, very clear about what they knew and what they didn't know. They weren't like trying to snow the population over, and they were very sensible in trying to. They made mistakes. Like early in the pandemic, they actually did send COVID-infected patients to nursing homes in Stockholm, and they apologized for that very, very early on. The Danes were also interesting. All of Scandinavia did well. The Danes actually, they closed schools and then they apologized for closing schools. I mean, it's just refreshing. Like you get the kind of spirit that you've been recommending through this podcast about like, let's just say like we got it wrong. It's okay. I mean, we're not perfect. These are like complicated things where there's things we don't know. I think people are forgiving when you have that spirit. They're much less forgiving when you have this haughty, if you contradict me, you are not simply contradicting men, you're contradicting science itself. That kind of spirit is guaranteed to produce lack of trust.
And it also produces conspiracy theories. So let's talk about that for a minute. So the extreme version of all this is Anthony Fauci and Collins and the CDC and so on. They are trying to control and take away our freedoms. It only starts with the masks and then the mask mandates, then the vaccine mandates. All this is part of this larger conspiracy to take away our freedoms and, so on and so forth. How far do you go with any of those?
So I don't think it's a conspiracy in that way. I think that it's, so my model of these kinds of things, the conspiracy theories happen because people want some grand unifying theory of everything. And it's the simpler explanation is that something very bad happens. Like I think it leaked out of a lab, and all of a sudden there's a crisis and there's fear, and a lot of people, some well-meaning, some not, jump in trying to do something to like address the crisis. The well-meaning people may do things that may be well-meaning, but they still can cause harm. Like I for instance, I put the sort of cutting the corners on the regulatory apparatus that surrounds vaccines in that category. I don't think it was a conspiracy. I think it was like, you look, oh, there's this global crisis, we have to do something. Let's not let regulatory burdens get in the way, right? That's well-meaning, and yet there is harm that's come of that well-meaning thing. There are like profit motives for pharmaceutical companies to hide things, so there are like less benign things, but those are not conspiracies. Those are like people taking advantage of the situation they're in and the resources they have. And I think that goes really far in explaining most of it. It's not that, and politicians, of course, are no different, right? So when there's a crisis, you'll see politicians push for their preferred view of how the world should work. And so, like, there should be more power in the hands of rational people. People will use that to like get more power in the hands of people. We can call them rational or not. The government's trying to take over everything. People will try to push those ideas. It'll be harder for them because people are scared and they're going to look to gurus and the government to try to protect them. So I think if I was going to write a sort of a social history of this, that would be the main kind of thrust.
Yeah, I agree with that. I think that's true. I was watching the RFKJ episode on Rogan. I think he was on like 3 hours. And part of the problem with him is that he throws out so much stuff, and you start looking him up, and it's like, that one's true. And that one's true. Now, this one sounds like bullshit, but that one was true. The regulatory capture by Big Pharma, for example. I had Gerald Posner on the podcast. He wrote that book on Big Pharma and the whole Sackler family and Purdue Pharmaceutical and all that stuff is like, oh my God, that's exactly what they did. I mean, that's a kind of conspiracy, but it's a corporate conspiracy, which does happen.
Well, see, the thing about that, there's a motive, and then there's like power around it, right? Those are not. I wouldn't even call it a conspiracy. Like it's complete. The Sacklers, what they did. I remember this distinctly in med school because it was the mid '90s. I was in med school, and they were like, okay, pain is the fifth vital sign.
Yeah.
Right. If you allow, and if you have this new drug that's not addictive, how dare you let patients be in pain around this? And so like that's how they got doctors. And doctors, of course, the reason why they got doctors to do this is because doctors don't want their patients to feel pain. Right. That's completely reasonable. The regulatory apparatus, it's captured in ways that are completely understandable given what we know about government processes. It's not like that's a conspiracy theory. It's just the way that the government works. When you have a regulatory body, the people that are regulated by that body are going to work very hard within the democratic system to try to like get their voice heard, and they have a much bigger interest in getting their voice heard than patients do. It's just it's a flaw in our system, not a conspiracy.
Yeah.
Right. And I think that RFK Jr. is really interesting. As you said, like there's a lot of what he says is really, really productive and interesting and right. And then there's stuff where like I don't agree. I think he just wants like if he had scientific advisors that conversed with him without trying to demonize him, my sense is that he would like listen, right? I don't think of him as like,
I don't know. Paul Offit's been trying to engage with him and he doesn't really respond. He'll say, I don't want to be wrong. So if anybody has a response to this particular study done in 1973, and then Paul Offit will post something, go, no, you're wrong about that, and here's why. And then there's no response. I don't like that. You should engage.
Yeah, I do agree with that. I think it's one of these things where like, what choices do you have? Like you don't like the politicians aren't great at engaging in those kinds of things generally.
Yeah, but the free speech issue, let's talk about that for a minute, since you were at the pointy end of the censorship program there with the blacklist on Twitter. This came out with the Twitter files. So good on Elon to give all those files over to Barry Weiss and Michael Schellenberger. You must have been shocked when you saw your name like, oh my God, I'm on the list.
The funny thing, I didn't join Twitter till August 2021. In fact, I told all my grad students, don't join Twitter ever. This is like for decades. Because like, this is how you change the world is by doing good scientific work and publishing it, right? Just quietly do science. That was my naive philosophy before. I joined Twitter and I get 100,000 followers almost immediately. And I'm like, this is great. All my colleagues in academics, they have 1,000 followers, 100 followers or whatever, and they get no engagement. I get 100,000 followers. And all these followers are like, way to go, Jay, right? And it was a little while later, I was like, why am I not getting all the people that hate me on, like attacking me on Twitter? What's going on? Twitter's a much nicer place than I realized. And when Elon bought Twitter, and it turned out I was put on a blacklist. It was actually a trends blacklist. what it was, and no one told me that I was put on this blacklist. I was just put on this blacklist. What it meant was that I would post and my followers could see it, but nobody else would see it. Right? There was no chance of it going viral outside.
So if one of your followers retweeted something you posted, it wouldn't get spread.
I think there's some like probabilistic algorithm around that. So a retweet may or may not be
shadow
seen by
banning. I think they call it shadow banning.
Yeah,
you wouldn't see it.
Yeah. So they wouldn't. Other followers of my followers would be less likely to see my posts. Followers of my followers would be less likely to see my posts. I think that's what a trends blacklist is. It reduces the likelihood of some tweet of mine going really, really, really viral. I tried to apply for a blue check mark in the old system, and I got told I wasn't notable enough, which is, I think it's fair enough, I guess. But I'm probably the most notable fringe epidemiologist in the history of fringe epidemiology. But there's that. But I think I think what happened was that the government was threatening Twitter and telling them don't platform people that are opposing government policy. And that's really what the blacklist was about.
So there's no question, though, that somebody in Twitter, an employee, had to go in there and tweak the algorithm for your site and whoever else was on the list. Yeah.
No, so so what I just said about the government doing this sounds like a conspiracy theory. Let me defend myself. There's a case called the Missouri versus Biden case where we brought the Missouri and Louisiana Attorney General's offices brought this case against the Biden administration. Through this case, we managed to read the emails of the White House, of the CDC, the NIH, and other organizations within the federal government. Their communications with Twitter and with Facebook and all these other, and essentially what you see is a pattern of threats by the Biden White House telling social media companies that you must censor these people and these ideas, or else. Often the or else is implied. The or else is like, we'll do something to you via regulatory policy that'll make your life really miserable as a company. And it didn't matter what people were saying was true or false. It just mattered that it was supposed to go. It's like I brought up immunity after COVID recovery or something. That was a theme that they really didn't want out there. And so people that were posting, you'd see emails from these government organizations to social media saying, don't allow this idea to spread. And sometimes you'd see the social media companies push back and say, well, this doesn't violate our terms of reference. Why do you want us to to suppress it? That what they're saying is true. Why do you want to suppress it? And the threats are still there, right? One of the federal judges that looked at this case. He wrote that it was as if it's like Al Capone going to a business in Chicago and saying, "That's a nice business you got there. Wouldn't be ashamed if something would happen to it." So it sounds like a conspiracy theory, and I would have told, if you told me in 2019 that something like this could ever happen in the United States, I would have told you you're a conspiracy theorist. But it actually happened, Michael.
Yeah. And again, it gets back to where we started with that kind of assumption that the public is too dumb to understand the nuanced arguments, so we're going to make the decision for them, because if these ideas spread, it could undermine our policies to try to save lives or whatever, right? So Rogan has on Malone, and he gets pushed back for that. He has RFKJ on, and he gets pushed back for that. He says, okay, I'll have on Hotez. What's it? Robert Hotez. Peter Hotez, yeah. And then, Hotez says, no, he goes, okay, I'll give you $100,000. I couldn't believe that. And then other people kicked in. It was like a 1.2 million or something, or 2 million. And he still turned them down. Okay. So now, first of all, so here's my commentary on this. When you're watching Rogan, you're not watching 60 Minutes, in which a piece has been, researched and vetted for 6 months before they air it. And you're getting each side. And so that's not what you're getting when you watch Rogan, or, there's a million podcasts, right? You're just going to get what he does. Okay. And he's willing to talk to anybody. Okay. So he has Hotez on. All right, fine. But there seems to be this sense of, oh my gosh, if people hear what RFKJ or Malone says, then this will harm them somehow. Anyway, that's just that.
It makes no sense, right, Michael? I mean, I think I can listen to Joe Rogan, and he had a guest on that was talking about some crazy theory about the cycle of periodic.
Oh, that was the actor Terrence. What's
I
his
forget,
name?
but
Yeah.
I can listen to it and hear that guest, and I don't like, I'm not going to go change my mind about the periodic table because of
Right.
him. Like, he's just having conversations with people, and they're interesting, right? It's actually, like I remember sitting around in graduate school and we'd argue about stuff. That's what it feels like, and it's wonderful. Actually, it's what science really is to me. It's like, let's explore in a free ranged way how the world works, and then we tether ourselves with data, we tether ourselves with analysis and logic and all that. But the nut of it is this, like, let's just talk to each other and see how we think the world works.
Yeah. It bothers me that it's become so politicized, like this economic organization you're part of. Wikipedia is, this was partially funded by David Neilman of JetBlue, and he's a libertarian. So what? What I mean, what
that one, by the way, is just slander, right? So, like, what happened there? I ran a study early in the pandemic, where we measured the number of people with antibodies in the population in Santa Clara County. That was the Santa Clara County. We published it in the International Journal of Epidemiology. We found that it was like, for every person that had been identified as a case, there were 50 people walking around Santa Clara County in April of 2020 that had already had COVID, that had antibody evidence of already having had COVID. Really important result. David Neilman he's a founder of JetBlue, but he wanted us to run this version of the study in New York, and I didn't have the infrastructure to run in New York. But he was like, he was kind enough to, like, we ran the study for like there was $100,000. It was a really cheap study for something. We organized it in 2 weeks. It was a really, really, I thought, like, what am I supposed to do as a scientist other than do science in the middle of a pandemic, right? So it seemed like I was doing my job. Neilman gave $5,000 to jet to Stanford to offset the operating cost of the study. It was funded by small dollar donors all across the board. Lots and lots of small dollar donors, right? I saw $0. In fact, Michael, I've taken $0 of any money for my COVID work. I've done dozens of these pro bono cases on the anti-lockdown, anti-mask mandate, anti-vax mandate side. $0 I've taken. I turned down honoraria. I've just feel like it's irresponsible for me to take money and profit from this pandemic. I've taken no money. BuzzFeed writes a story accusing me of taking $5,000 from Neilman, and now it ends up in Wikipedia. It's just like laundering a defamation. It's like a laundering of defamation. It's just absolute nonsense. And it's mainly because they didn't like the result of the study, right? The study implied that for every person that had COVID, there are 50 people walking around Santa Clara County in April 2020. That meant the lockdown had already failed. That meant the horse was already out of the barn, that the lockdowns were not going to work. And that also meant that the infection fatality rate was lower than people were saying. And so rather than cope with the result, try to replicate it and contradict it that way, instead, you have this like smear machine trying to destroy my life, and the other scientists working on it. And you still see it in Wikipedia. It's just nasty. The way that the ecosystem of science worked, I didn't realize how nasty it could get. I just saw it firsthand during the pandemic. For 2 straight years, I got death threats. Whenever I appear in public, whenever I write a scientific study, I get death threats. Until 2022, that happened. It was terrible. I mean, I sometimes see Tony Fauci complain about death threats, and I totally understand. Like, it's a nasty game. I think that should be out of bounds. But I think that $5,000, that still bugs me.
It should bug you. You have a remarkably positive attitude about things for all the shit you've taken. So good on you. Maybe that's your temperament. If this happens again, or I should say when this happens again, because it will, what do you think would happen if the government came out and said, okay, we're going to shut everything down just like we did last time? My sense is there'd be just a massive public revolt.
I think in the United States, that's true. I think that especially in red states, you're not going to get, there's been lots of efforts to like restrict the power of public health because of the abuses during the pandemic. I think that that's actually healthy. I think the key thing is checks and balances. The way you restore trust in public health is to have formal checks and balances in place so that public health can't behave in an authoritarian way. You also need new leadership in public health. I think at this point, this leadership is shot. Like people will not trust it again. And you're absolutely right. If there is another pandemic, but I do think there'll be an effort. Like there'll be an effort to scare people. And I don't know what happens when people get scared. They do crazy things, Michael. And I could very readily imagine the public being very, very scared about something, and again looking to public health or Tony Fauci-like figures to try to get them out of it. So I do think that it's very likely in our lifetimes we will face another pandemic that will result in the disruption of lives similar to what we saw. Certainly that's a threat, and unless there's explicit reforms, I'm really afraid that it'll happen again. I think the first step is something like like after a plane crashes, you go check the black box, and you're not trying to point fingers, you're trying to figure out how to reform the system so you don't get the plane crash again. We need something like that. It may be too late. It may be too late to have that. I mean, at this point, I think at one point in the pandemic, I was sure that scientists would come together and like try to conduct something like that on our own. It may be too late. I think at this point, it's almost going to take some kind of political upheaval to force it to happen. But when it does, I want the wreckage of public health to be sort of redeemed in a way that preserves the good parts of public health, which I think are really essential for the health of the public, and toss away the bad parts. No more manipulation of the public. No more noble lies. No more pretending like the public can't understand nuance. More real scientific work to inform the public about the realities of what's happening, more humility, more accurate communication.
Yeah, I agree completely. It may take what Max Planck described as, science progressing funeral by funeral. Maybe just the old guys have to all die out and go away, and we get a new fresh blood coming in going, all right, we're going to do it different this time.
Unfortunately, it may take that, but I think with public health, a political upheaval will be enough.
Yeah,
it shouldn't take a political. Public health isn't politics, right? Public health is like, if I don't win 95% of the public, I'm a failure in public health. In that sense, Michael, I'm a failure in public health, right? I have not persuaded 95% of the public. It's not like politics where 50 plus 1 is enough.
Yeah, right.
And public health needs to hold itself to much higher standards than it holds itself to.
Okay, well, there's your book. You write that thing and what we should do next time. All right, Jay, thank you so much for your work and for talking to me about all this interesting stuff and important.
Thank you for having me on. It's a delight to talk with you. It was really fun to meet you in Florence.
Yes, that was great. Yeah, no, totally.